The 2023 annual report from the Nueces County Medical Examiner's Office was accepted during Commissioner's Court today, and some of the data was alarming to hear.
Out of 545 post-mortem examinations, suicide ranked as the third leading cause of death for our area, and that number comes at a time where mental health resources and conversations are seemingly becoming more common and normalized. The News' Faith Colbert spoke with a medical crisis professional about what could be behind these numbers and who can help. Faith?
Good evening, Leslie and Rudy. I stopped by the Nueces Center for Mental Health and Intellectual Disabilities, MHID, to find out why suicide numbers may be on the rise in our community. Now, there are various factors that can contribute to someone taking their life, but one thing that is for certain in each case is the decline in proper mental health. The 2023 annual report from the Nueces County Medical Examiner was disheartening to see when just a year prior in 2022, suicides represented 10% of lives lost. But comparing that to the most recent study, that number jumped to 12.5%. As the program supervisor at MHID, Victor shared with me how some people end up in a place of contemplating the value of their life.
So when somebody's dealing with a situation that could be considered a crisis, there are different factors that they may be experiencing.
Factors such as a sudden loss, a change in income, or even experiencing something new can result in the final straw. But adults are not the only ones with the cry for mental assistance.
Youth encounter crises as well. We see it in the school systems. Kids go and talk to their school counselors.
More than half of suicides that occurred last year were from males. The report also shows that the most common cause of death was by gunshot wounds, and Victor's responsibility as program supervisor is to assess each individual thoroughly so that suicide does not become an option.
We go and assess and figure out what is going on with the situation, what caused the change, because normally it's circumstantial. Something happened that there was an onset of this issue, and we want to make sure that we get the full story to be able to better help this person.
But if one is already having thoughts or has tried to commit suicide, Victor says,
the important thing that we can do is to try and meet them at that moment and intervene in a quick way to try and reduce suicide from happening.
If you or someone you know is battling mental health issues, know that help is out there. We will have crisis prevention resources linked to this story at KIIITV.com.